Hello, my name is Nicholas Torres. I serve as the Chief Operations Officer at the Alliance for Health Equity. I also serve in an advisory and partner capacity for Coatesville's Second Century Alliance, United Way of Chester County Social Innovations Lab, and Chester County Community Foundation's IDEA Council. Following the closure of the Jennersville and Brandywine Hospital in 2022, the Alliance was determined to minimize the disruption of healthcare services to our Coatesville residents and rebuild a stronger and more equitable healthcare system. We could not do it alone, and therefore organized the Greater Coatesville Health Equity Group. This group is composed of a cross-section of government, service providers, funders, and community champions, leaders that collectively use their expertise to strategize and implement action steps to improve health outcomes. We first conducted a health survey for Greater Coatesville residents to understand the impact of the hospital closings on their lives. We are so proud of and thankful to our community for receiving over 1,100 responses to the comprehensive health survey. The community voices told us that a place-based approach for health equity is not possible without, first, creating an integrated health delivery system and a centralized hub created from the perspective of a Coatesville resident to access quality healthcare services. Second, removing access and engagement barriers, including but not limited to transportation, mental health stigmas, and technology or digital divide. Addressing the underlying health issues of affordable and stable housing, earning living wages, and access to affordable and healthy food became the third strategy. After a year and a half of planning, we are proud to bring you the Anchor Strategy, a place-based approach for health equity for Greater Coatesville. The drivers for the Anchor Strategy are organized around integrated health, access and engagement, affordable and stable housing, living wages, and healthy food. We aspire to achieve the following goals that include, for integrated health, increase health delivery collaborations and partnerships that effectively address and communicate the continuum of care for Coatesville residents by 2026 through a 25% reduction of chronic conditions via early screening, coordination of care, and chronic condition management, a 25% reduction of emergency calls and crisis emergencies by incentivizing behavioral health care through early intervention, a 25% increase of knowledge of where and how to get insurance and health care. For access and engagement, we strive to remove engagement and access to transportation, technology, and navigational barriers for the Greater Coatesville population by 2026, prioritizing underserved populations, resulting in a 25% increased utilization of healthcare services, a 25% increased utilization of transportation for healthcare out of the Coatesville ecosystem, and a 25% increased utilization of telehealth in underserved populations, and finally, a 25% increased knowledge of where and how to get health and behavioral health services. This will result in a 25% reduction of chronic diseases. For social determinants of health, we aspire to increase employment and living wage employment in Coatesville for adults by 25% by 2026. We will increase housing stability, homeownership or rentals in Coatesville for adults by 20% by 2026. We at the Alliance for Health Equity, on behalf of the Greater Coatesville Health Equity Group, invite you to be involved with the Anchor Strategy by helping us determine ongoing initiatives to achieve these goals. Please feel free to reach out to me at ntorres@alliancehealthequity.org or 484-257-9835 to learn more about how you can become involved through Let's Talk Community Design Solutions, community outreach, donations, and more.